And thank you very much to Sister Pinto and Dr. Prachi Devda for agreeing to our request to be here. I'm Vandana Gupta, founder of We Care Foundation. And in the last couple of years, one thing that COVID taught us was, how to use technology to spread education and knowledge. And we are grateful for that. And, over the years, the last 2.5 years, we've done a lot of series where we've talked about various types of cancer and we've talked about various treatment modalities and all that. But we thought this was an opportunate time to talk about the nurses who look after our patient. And most of the time, the nurses do a lot of work, but always in the background and never really, their issues never come out in the open. So that is how we decided to have Dr. Pinto. And Dr. Prachi is a patient who has had some experiences with Dr. Pinto. So I would like first Dr. Prachi to introduce Dr. Pinto, and then I'll take on the question with Dr. Pinto. Dr. Prachi, please.
Yeah. Hello, everyone. I am Dr. Prachi. So I am going to introduce Sister Pinto as I know her, because I may not know her qualifications and her position, but I know her as obviously she's the head of the BMT nursing team, but she is a very warm person who comes and, talks to every patient. She is a very, very patient and very empathic human being as I know her. And I have had some very nice experiences with her. And I think that is all that I know about her. I mean, okay. I know her more as a human.
I've known Sister Pinto for many years, always smiling in spite of all the issues that she must be facing, and always there for the patients. So warm welcome to you, Dr. Pinto, Sister Pinto. Let me ask you questions right away. What inspired you to be a nurse, and how does it feel to be in the family of Florence Nightingale?
Oh, thank you, Vandana ji, for that question. Actually, every time I used to see a nurse, and every time I would see the picture that is, in one hand the watch is there, on the other hand the thermometer, so, and with that white uniform, with a cap, white cap, I was just inspired with that. Secondly, and then I would always feel that, great and wanted to be a nurse. But when I lost my father at the very young age of 6, then I wanted to become a nurse, because I felt that moment I would have been a nurse. I could save my father. I don't know that answer yet, but that is a moment I felt that I could have been some help for my father. But then I thought to myself, yes, I have to become a nurse. And that is how I came for nursing, and it just happened. And that is how I'm here today, 35 years of my service, serving Tata Memorial Center, And the family member, any of the family members should be a nurse. I feel either a doctor or a nurse. That's because, one medical hand in the family makes a lot of difference. So for the simple reason that if somebody is having a viral fever, you don't have to just rush to the doctors. Every time you get fever, you run to the doctor. But if the nurse is there at home, maybe that, immediate care, you say first aid, that is always taken care of at home. For example, taking blood pressure, saturations, or maybe a blood sugar. If these are the things can be taken care of at home, and then if you need, then you can visit the doctor. This is what I feel. Secondly, I think it's very important to be in the family, a nurse, because to give you my own example, my son is in Merchant Navy. He's sailing presently. So whenever he's going on a ship, I always tell him, Baba, this is the medicine for fever, this is for your toothache, this is for your cold, that kind of a thing. And that makes me so relieved that no, my son is with medicine. I know he will not be, he will be better. So that is what I, felt it, that one Florence Nightingale has to be in the family.
That's very nice. And your own personal experiences motivated you to join and take up this profession, which is really very, very honorable. And I think a great salute to all the nurses who are working, and because you really make our journey as a patient so much more comfortable. And I personally have begun to feel that, the human part of a nurse is what is most important. And it is more than the doctors, because the doctor visits us for 2 minutes or 3 minutes while we are in the hospital. But you spend so much of your time with us and take care of us. So now tell me something. I'm sure you've faced many difficult times, difficult situations, sometimes a difficult patient, sometimes a difficult colleague, a doctor, anything like that. So would you like to talk about these things?
Yes, yes. Thank you for the question, Vandana ji. We always go through, difficult times. But I remember one patient who was admitted for more than a month because of his WBC counts were low. We were not able to discharge him. But then he was not willing to stay in the hospital, and everywhere, it was just a curse. He wanted to go home, but then we were helpless. We just couldn't send him home, and he was not staying in the room, coming out of the room, throwing tantrums, always coming out and sitting on the nurse's head, so much so all of us tried very hard, but it just did not. But then later on I thought that, I think if I get one survivor, will it make difference to that patient? So I called one survivor and he came, and both of them, I pushed them in the room. They were there for 4 hours discussing. I till date I don't know what have they discussed, but yes, when the survivor came out, patient was okay. I don't know what they spoke, but yes, that made a difference when the survivor spoke to him. So that is a, and now if the patient is coming, whenever he is coming to OPD for follow up, he will come, but then he is still feeling shy because how much I troubled those sisters and doctors. So that is the thing. But I think getting the survivor to speak to him was the right choice. Otherwise, it was very difficult for us to, And coming to the doctors who are not difficult, but what happens? We have every 3 months changing over the doctors, and some are coming from the different centers, and so we have to we want them to fall in our protocol, which is a bit difficult sometimes to doctors. So keeping telling them 10 times the same thing, they are irritated, then they feel that sister is behind me, so that kind of a thing. Otherwise they are not difficult, but anywhere if I go also, I don't want to follow in your protocol, I will follow my protocol. That attitude sometimes is there, but otherwise I don't think any of the doctors are really, or the colleagues are really difficult. That is what it is.
So you're being very nice to the doctors, that you've never faced any difficulty with any doctor, somebody who's lost his temper, somebody who's got angry because of whatever reasons that may be and all that. And what about the nurses who work with you? Sometimes do they also act up, or do they not listen to your instructions, or do you find it difficult? It must be a challenge to handle them.
Yeah, no, nurses are not that difficult too, because I just love them. I just hug them anytime they come to me. I just hug them and give them the leaves whenever they want, and that is how it is. So I don't think nurses are difficult for me, at least, to manage. They are really good. If you are good, I think the leader has to be a listener and being good with them, and they are okay. So I don't think we are difficult nurses at times. But I did not have any, never faced such thing.
Okay. Sister, we know that all through COVID, all of you were working, and it must have been a tiring time because the treatment never stopped, and all of you were on your feet with the fear that you might be carrying COVID home, or, like infecting others and all that.
Yes.
So, first of all, what was your experience during that time?
The nurses experience stress, burnt out, compassionate fatigue, and moral injuries always there. But because of COVID, we had a lot of shortage of staffs, because half the nurses were down with COVID, or there was no transportation where nurses wanted to come, but then there was no transportation. But then some stayed away from the families because their residential societies were sealed, where they were not allowed to come out of the society and to come to work. So what our institute did was that we give them accommodation and the food, so that they can stay in the hostel and serve our patients, because with the shortage we could not afford to letting them just sitting rightly home. But then they also showed interest that, yeah, they want to serve the patients. So that is why all my nurses were here. And some were like leaving the small children, they were here, then children were at home loaded with the work here. Some have done double duties, so that kind of a thing. But my nurses never gave up. And secondly, the stress was because of that PPE, that personal protective equipment that they were using. Without that, they were not able to handle the COVID patient. So that was very uncomfortable. They would sweat. They could not go to washroom. Some were actually using a diaper and they did 8 hours, 10 hours duty. So that was, some were using a specs where because of fog that they were not able to read, right. So that there's so many problems. Whereas if you look at the doctors would just, as you mentioned earlier, doctors would just come for an half an hour, 1 hour so, and write and go. But then who's going to be the patient is 24/7 are the nurses. So that in short, the nurses do not compromise in patient care. That is what I felt. But then with the shortage, we really had a tough time. But then at the end, some nurses really reported insomnia. Insomnia is loss of sleep, because they were worried for exposure, fear of infected patients carrying home the children. So that kind of a thing. Also, it affected the patient's point of view. I will tell you, because of COVID, we were not allowing the relatives because you don't know from where they will come. And if they give a COVID with this disease and COVID, it would have been a difficult task and not good for them. So that is what from the patient also I feel that we were not able to do it. This is what is a story for COVID.
So after all the learning that you got from COVID, sister,
Yes.
what are the changes that might have come in the attitude of everybody, or is there any major change that you've incorporated because of your learnings from COVID?
No, now they know, because earlier what used to happen, nurses are, whatever the weekdays off, they would take the off. But now it has come that they themselves will tell you that, sister, agar, if there is a need, you tell me, I don't mind canceling my off and coming. So,
good evening, friends. We are here to.
there's some noise in between. Hello?
Yeah, sister, you continue.
So that attitude has been changed, and they are just willingly, if I tell them double duty also, so that things are changed. And looking at the perspective, which were not, we used to keep our 2 hands distance and all, that has come down now. So basically, we are just coming up, coming out of that fear and things like that. Yeah.
Can you, does any one situation come into your mind which you must have found very, very challenging, and how did you cope with it? Any one situation that you
Yes.
would like to talk about?
There were many, but to tell you one or two, to start with, I remember during COVID only, we had a baby who was just 1 year and 9 months old. And with her admission, the mother was inside. But after a few days, her mother had viral symptoms, and we did a test, and she was positive for COVID. So then we had to take her father. But then once we took a father, child was not comfortable with the father. Rather than the child was comfortable with the nurses. So then what happened? Ultimately, when the child was going sick, the same time the father was also came COVID positive. Then everything came on nurse's head. And then keeping, so have to keep extra nurses because the child was not lying down in the bed. We used to take the child on the laps, the putting her to sleep. Everything was done by nurses. In spite of shortage of nurses, I had to keep extra nurses for her because medicine itna hai, injection itna dena hai, and plus you have to hold the child in your arm. So that was something was very difficult for us. But yeah, in short, it was difficult bus to take care of the child without parents. But we took it as a challenge, and managed her. At the end, I felt that we were very attached to her parents and all. We were considering it to be a part of our own family, the child. So now when that looking at the child who's coming for OPD, she comes running. Sister Pinto ko milna hai. So now she's 3 years old. But that was, amazing because without parents, just managing the 2 years old child was a difficult task in COVID eras because of shortage nurses. And then another, I feel that I don't blame the patient, but we had one Jain patient who wanted only Jain thali. Jain thali mein khana khaunga, Jain thali ka hi food chahiye. So, and then our cooks are not very much, preparing the Jain food. So that somewhere we were, going through the NEET and asking them to prepare. So by third, fourth day, 3-4 days, patient was not happy with us. But later, after 3-4 days, we could manage his food. It's called a Jain Thali. So that was also, I felt that, was a difficult challenge for us in a diet. That's all.
So do the parents appreciate the fact that you looked after the child so well and
Yes. So they are very much into, now they are feeling so, sister, aap log hai karke mera bacha bahar nikla. So that is, so it's a compliment for us, that, and they, every 3 months the child is coming now, they come and see us. That is something, they feel. Otherwise, every patient don't come, but these are the people who are being very, polite and fantastic. So that gives us also encouragement, this is what we have done during COVID. Yes.
yeah. Really, your efforts are absolutely laudable because among
Yes.
the situation that you would like to talk about, what is it that is your biggest challenge in the hospital or at home or dealing with home and hospital? What is your biggest challenge?
Biggest challenge is during COVID, if you are asking, and the same shortage of staffs was my biggest thing. I at times I have to cancel their duties, their offs, and making them double duty. That was the biggest challenge for me. Sometimes, they were saying chota bacha ghar mein hai, but I would still tell them, patients are, because as you said, the treatment never stopped. So I think that was a way of looking at it, that no, patient is a priority. So that is what. But then yes, nurses at the end, they were all willingly doing it. They were saying, nahi sister, agar aap kar sakte to hum bhi karenge. So that is what it was. At times it was challenging, because to get the nurses, your quota was a really difficult task.
And sister, you mentioned that your son is in Merchant Navy. So was he with you during that time or was he on the ship?
No, he was here. He just came 2 days ahead, and after 2 days, lockdown happened.
Oh.
Yeah, otherwise it would have been really, maybe for 2.5 years he would not be able to come to India. Yes.
I think I lost you somewhere, sister. Can you please repeat what you said about your son?
I said the time he just came to India, and after 2 days lockdown happened.
Okay.
Yeah. So then this 2.5 years he was here only. He couldn't go. That's because of COVID. Yeah. Otherwise it would have been like, till the COVID gets over, he would have been in the US or wherever, whichever country then he's selling. Like, so good that he was here.
Okay, suppose, patients ask you complex questions which they can't ask the doctor.
Right.
But the family says something. How do you take care of that?
It is again a difficult task sometimes to answer their questions, but yes, nurses have to be a good listener, because as I'm saying, the doctors would just come, disclose it, and then go. But later on, 24/7, we are only there. So they have questions like, after taking chemotherapy, surgery, or radiation, what is my recovery? Which doctor they don't answer. Even we cannot answer, because you don't know what is happening inside their body. That is question. Then second is that employment. They'll ask when I'll be able to join back this job, or then you make them understand your accounts are low, you still have to get better, and then you can go back to, if you want some medical certificate, that we can give. Or sometimes because during COVID there's so many people have lost the job, so in our hand what is there is that we just refer them to the medical social worker. You will not believe, for some patients we had brought a food, the breakfast is from home, and we gave them. So we work to that level. Now coming to the sexual issues, I think it's very important. I personally feel that it's a basic need of man, but some females they will ask, but then you have to be in what to answer. But if you explain them that yes, it is important, and when you can have a sex, It's difficult for me sometimes to tell them, but I be in their shoes and see where they are. It's a basic need. So nurses have to be openly talking to them. It's a bit, sometimes you don't want to say, but if the patient is asking, yes, I have to answer. So that is what is. But then young girls are a little hesitant too. But if the question comes to me, yes, I am definitely answer. Now I don't want to discuss it on this platform, but yes, I make sure that I explain them. Some ask for the marriages. Yes, we sometimes say that, the junior nurses, are you ask doctors? You don't have to ask doctors. We just have to see their disease status. And if they are, in the remission period, of course they can get married. So then I tell them, there are some examples where I remember one patient was in Tata Hospital where we had to tell the patient to have a sperm banking because he was just young and just married for 3 months. So then when we told them to have a sperm banking, he actually got it done. And then after his treatment, he now the IVF was done and he's having 2 daughters. So there's one more patient also had the same problem. Bacha hoga kya nahi? Then when we told them to have a sperm banking, and he went for it, and now also he's married and having one child. So it is up to us how we take it. Those their questions are complex, but it is up to us how do we explain them. And I think it's a patient's right to ask them. Some ask the disease coming back, it's definitely uncertain, you just cannot answer. But I tell them in my language that even if it comes back, you are a big fighter. You take it as a, you be positive, and once it comes, you just fight it out and go ahead. And then they ask about the social gathering. They want to go for somebody's marriage with a surgery on the face, they can't go, or some other problems they can't go. But then to make them understand that this is not the end of your life, this is not the end of the time. But once you get all that, you can go there. So if you, I think, just explain them in that this thing, I think these questions can be taken care of. But these are the main questions asked by the patients and the friends, relatives.
So talking about sexual harassment, the patients are there, they are frustrated. The patients are okay, they are lying in bed, but the caregivers are frustrated. And do they sexually abuse or assault any of your nurses or staff? Have you had to face that situation?
No, it has never happened. I don't remember in my history. No, it has never happened. Never happened.
Okay.
No.
Which is a very good thing, no?
Yes, it never happened. Never happened.
Okay. So before we move on with you with more questions, Sister, I would like you to introduce Dr. Prachi. I believe she was a patient when you looked after her. So if you can first introduce her, and then I will ask her the questions.
Yes. Prachi, I know her the time she was admitted. And you enter in the room and she'll say, hi, good morning, Prachi. And Prachi smile, takes the whole room. And so, during her transplant, her mother was there inside. And, the thing is that morning I would go wish her and just give her one hug. And then at the end of a conversation, she needs one more hug. So that every time, and if I don't go to her room, she will miss my hugs. So the same she had told other patients whose I will not take the name, but then she said, for Prachi, you are giving 2 hugs and for me only one. So that kind of a thing, we were really having a bond, a great bond. I never considered her that she is my patient. I always thought that, she is my family member. If it's my family member, how will I do it? So that kind of a thing. And I have always told my nurses to put in the practice that you be in their shoes and, tackle the things. Though she had lot of problems, but she was a person who never gave. That's the example. That is why I think Prachi is here. I think she will agree to that.
Okay, so let me also add on that she's doing her specialization in pediatrics from Surya Children's Hospital in Santa Cruz, and she was diagnosed with
dysplastic
syndrome in 2018 after her MBBS. And then she went in for bone marrow transplant. That's right, Prachi?
Yes.
Okay.
Absolutely right.
Now you've moved the journey from being a student to a patient and now to a doctor. So tell us something about yourself first and also about your story. and about your cancer and the treatment. So we'll move from the time that you were a student studying to become a doctor, got affected by
Right.
cancer, and then now.
Okay. So, hello everyone, and thank you, Pinto sister, for your wonderful words. Yes, and I do miss your hugs very much.
Yes.
And I have always wanted to become a doctor since childhood. I don't know, I don't have any reason for that. So when I went into MBBS, I was all okay. Everything was good till the final year when my count started dropping a bit. My platelets started dropping after my final year exams. So initially it was thought that it's not some malignancy, it's some benign condition. It's something which is not cancerous. So, but later on, everything started going down, and I was diagnosed to have a myelodysplastic syndrome or MDS. So when I got diagnosed, the first thing that came to my mind was what will happen to my career. Am I audible?
Yes, 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 Prachi.
Okay,
Yeah,
okay.
yeah, you are.
Yeah, okay. So what will happen to my career? How will it go forward? Because I had so many plans. I wanted to do my post graduation. I wanted to do my internship. But then that time I never thought about how much effect this thing will have on me and my family. But slowly, when the realization came in that this is a very big thing. It's a very big life changing thing. Then my focus got shifted from what to do in life. I mean, what about the future? From that, it got shifted to the present. That this is something that we have to deal through. It's gonna take a long amount of time. I have to have that patience. I have to go through this. And when I came to know about that I have to undergo a bone marrow transplant, that was a big thing because it's a very intensive treatment. It's a very long treatment. There are so many complications. And like Sister Pinto said, I remember very clearly the day Dr. Naveen told me the prognosis that, there's so much percent chance that you will die. There's so much percent chance that you will get completely better. And there's so much percent chance that the disease might come back. And he also told me that even if you get better, you may not be able to have kids, you may get some other problems in the future. And that time, what I thought was the future is the future, which is not in our control. Right now, what is in our control is to go through this the best way you can, give your best through this phase, and we'll see how the future is when it comes. So, during transplant, I think I had a lot of complications. I had, as Sister Pinto, she will tell you, I was there for 2 years. In and out, everyone, I used to get admitted so many times that people used to say, you don't like home, you like to stay in the ward. And so I used to be there many times. I had a lot of complications, but I think the overall way I wanted to look at it always was that this is not something where I wanted my life to end, my career to end, my ambitions to end. I always wanted to get out of it and consider it as one part of my life rather than revolve my whole life around it. I always wanted to, get through it, and then it's like a chapter of my
When you
life
had
was.
your treatment, maybe
Yes.
that time you didn't know any technical part of the treatment, right? So now,
No, actually,
as a doctor,
no, because I had already done my MBBS, so I had done an extensive research on what all problems can occur. But there were so many things that I learned before giving my entrance exam from the side effects that happened to me. So whenever a drug was given and I used to get a side effect, I used to learn about it from that. So yeah, it's right. Yes,
okay,
I learned many things from my own treatment.
good. So so tell me something, Dr. Prachi, that today, when you're working as a doctor in the hospital, have you had any marriage
Sorry, have you had any?
Marriage proposals?
No.
Are you not
No. I
looking
have
for
not had
marriage?
any.
No,
No,
is
I
it?
definitely want to get married.
No.
I am someone who believes that you need someone to spend your rest of the life with. That way, I'm a believer in love or marriage or whatever you want to call it. But I think, I will tell this very frankly to you that people have a lot of stigma that revolves around cancer, especially the disease, the side effects. And as you said, Sister Pinto also said that the thing about not being able to have children or the disease that might recur. So there's a lot of stigma that revolves around it. And not just from, layman people. I mean, the people who are not in this profession, even those who are in this profession, even those who are doctors will have a lot of stigma around it. So they would like to see you, I mean, get successful and, come out of it, and everyone will be appreciative of it, but they would not want that to be in their family. It's
But
a
let
very
me tell you something, Dr. Prachi, one of our colleagues, a volunteer with us, she had bone marrow transplant done almost about 26 years back or 27 years back. And she's doing extremely well for herself. And I
right.
want to say that, so that if there's anybody who wants to get married to you but is hesitating, they should not hesitate, because it's not like life ends or cancer kills everybody. So that's the
Exactly.
reason I'm talking.
I
Yeah.
agree with it. I agree definitely, but I was just, I mean, I know that this is not the end. I think I have tried to feel that and believe that and apply it to my life in many ways than one. But not everybody thinks that way, is what I wanted to tell you. And it would be very nice to change people's perspective around this, especially revolving around the future, around marriage, because there are so many young, not only girls, young boys who go through this. And just because they went through this small glitch in life does not mean that their whole life ahead should be, you know, judged by or managed.
So, staying in the hospital, I'm sure you had a lot of experiences with the doctors and with the nurses and, anything, all of them and the hospital staff during your
Yes,
treatment. And, BMT can be kind of lonely because you are by yourself and you don't know what to do with yourself and things like that. So, do you want to share your experiences about the doctors and with about the nurses? Something. I mean, we know that Sister
definitely.
Pinto used to come and hug you, but how did you
Always.
feel overall? How did you feel in isolation?
So I already knew that I would have to go into isolation for quite some period of time. So I was prepared very much for it. So I used to love drawing. So and during my MBBS, I did not get that much chance to do it. So I had taken a lot of material with me inside. But there were times when you just don't feel that good. You have so many side effects from the chemo. You have so many side effects from the other drugs. So I used to make it a point to talk to everyone, to all the sisters who used to come. I used to talk to the Maushi, Mama, everyone, even all the doctors. So I think more than the doctors, because the doctors used to come for rounds and then once or twice during the day, but the sisters used to be there always. So I used to always talk to them, get to know a little bit about them, show them my pictures before transplant when I had hair and when I was thin and I had a normal life supposedly. So I used to talk to them. I used to discuss my problems with them. They used to talk with me. So it was like a different family. Even out of isolation also, I used to make it a point to talk to all the patients also, all my co-patients who were there with me, because I used to always feel that, see, the doctors, the sisters, even my family won't be able to understand what I'm going through. They will try their best, no doubt, but they still can't understand because they are not in my place. But the patients, the other patients who are going through the same thing, they can understand my pain well, is what I used to always feel. So I used to always talk to all of them that, maybe if we talk to each other, share each other's problems, we might, it might make us feel a little bit lighter,
Hmm.
So I remember one I said, Pinto sister used to come every day and give me hugs. It's such a small thing I'm telling you, but it used to make my day. I'm not exaggerating it one bit, but it really used to make my day. Even now, recently, I had gotten a little sick, so I was admitted for a few days, and I was so happy when Sister Pinto came me. She said, "I heard that you were here, so I came specially to give you a hug," and I was so happy. So these are all very small things. There were other sisters also used to come. Even when after my transplant, when I used to go in the OPD, they used to see me, they used to call me, they used to come talk to me, ask about my family. All these small things were used to give me great amount of joy, without a doubt.
I think maybe you should make it a point to come to the BMT patients once in a month or something like that and talk to them and spread your brightness and cheerfulness with them. That would be really, really
No.
nice from the patient's
Yeah,
point of
so
view. Yeah.
yeah, I would love that actually. Whenever I go for my follow-ups, I make it a point to go to most of the times, I make it a point to go to the ward. Right now, I mean, the patients keep on changing. But yeah, when I was admitted this time also, I tried to motivate, some of the girls. They were young girls, 2, 3 young girls with me. So I told them that, it gets better. Look at me, it will get better, don't worry. So I really wanted to uh, change people's perspective about getting diagnosed with cancer. About it's I feel the word cancer only, most of the people, they feel that it's the end of life, but I personally feel it's not. If you don't want it to be, it does not have to be.
So, Dr. Prachi, maybe we should include you as a weekly volunteer and request you to come to the hospital once in a month, and we'll
I
fix
would
up a
love that.
program where you can come and meet the patients. And maybe, we can have a support group meeting at that time of the patients, and you can talk to all of them. And even if they are different patients, it will be nice because so many new patients will learn so much more from your experience. And that will be good for everybody. So
Definitely.
Jyoti will definitely get in touch with you to find
Yeah,
out
I
when
will
can we.
hold on to you for that,
Yeah,
definitely.
but I
I
will
would
hold you on to
definitely
your
love.
commitment. So we
Yes,
always
yes,
work together, right?
yes, definitely, definitely. I would love that.
So, Sister Pinto, we have a new person now coming to help us and join with us
Okay.
and help you in the hospital. And very soon we'll start this program.
Yes.
And Sister Pinto, one thing I want to know, the patients and patients and the nurses are together for such a long time. The doctors and the nurses are together for such a long time. Have
Right.
you had any any marriage happening between them or any affairs happening with them or something like that?
Sorry, I didn't get your question.
The nurses and the doctors
Right.
together for a long time. The
Right.
patients and the nurses are together for a long time.
Yeah.
Patients, relatives, I mean. So,
Yes.
has anybody married another this thing sister? Have you had any sort of relationship which has developed? We
No.
know of some of the top doctors who have got involved with nurses and they are living very happily. But
Yeah.
have you seen anything like that?
No. No. I don't think so. Nobody with the patients or the relatives. No.
No.
I
Okay.
think that
So
way
maybe.
everyone is quite professional. I should say,
Yeah.
because as such they are very friendly, but I don't think I know few sisters and brothers, amongst them, 1 or 2 examples I know, because that happened when I was there in Actric, but never between doctors and sisters and patients, or doctors and patients. That is something that I've not heard of. But I would like to also interject in this. So being from the medical field and being in Tata, getting in touch with so many doctors, I've had a good relationship with almost all of them, all the doctors. And even when they have left Tata and they have went to different places throughout India, they still are sometimes, they are in touch with me, and I really feel privileged that, I got to know them. That's for sure.
Good. So, one last message that you would like to give to people who are listening to this talk, Dr. Deodhar?
That question was for me.
Yeah.
Yeah, okay. So this I have said multiple number of times that whenever you are going through such a big thing, it's very important to not see into the future too much, to not stress too much about some things. If today is a bad day, if today you have gotten a bad news and it was the worst day of your life, doesn't mean that tomorrow will be the same. If today was the best day, it doesn't mean that tomorrow is going to be the same. So I always tell everyone that take one day at a time. Take one day at a time and have hope, because hope is something that is going to take you out of this full thing. Hope is something that will take you out of this disease, that you have to have something to look forward to. And that is what will sail you through this thing. And also, there are so many people who, you look very different when you are sick. You don't have any hair, your face is swollen, you have marks here and there, and I was no different. So my face had become one whole goal. And but I want to say that you don't have to be perfect to be happy. Just be happy and you'll be perfect. This is what I always say.
I've also come to know that you had taken a mandala art as a hobby during your treatment.
Yes.
So,
yes. So I drew.
You want to talk about that? Like, how did that help you?
You know what? I used to always draw. I love drawing, but I had never done mandala. I just stumbled upon it few months before my transplant, and I fell in love with it so much. So initially, I just liked the symmetry of it, the intricateness of it, and I used to do a lot. But then slowly, I felt that it is actually healing. It actually is therapeutic in a different way. Being a doctor, me saying these things might be funny, might sound funny to some people, but for me, it actually helped me so much. Hours used to go by and I used to not realize. I used to not think about what my counts are, what my medicines are causing me, what side effects are happening. I used to not think of that because I was engaged so much in this. So I made a lot of paintings, and all the sisters and the doctors, they were so appreciative of it. I had 2-3 exhibitions also, and I was promised that few of my paintings will be put up in the attic. So
we have done that.
So yes.
Do that, yes.
So your suggestion to patients would be to pick up something, some interesting thing like this,
yes,
or anything.
Yes.
It could be
Anything.
writing, it could be
Any
drawing,
hobby
painting.
which you can do with your limitations. I think that's what I'm telling you. Something to hold on to which is different from your illness. Something which will make you forget about the reality, at least for some time. It can be as simple as reading. I read more than 25 books during my full transplant period. Not studies, novels, different types of novels, because I used to like reading. It used to pass my time. I used to not think about it, and drawing also. So it can be anything. It doesn't have to be drawing. It doesn't have to be reading. You can sing. You can write poems. You can whatever helps you stay away from reality. Even as simple as those who like dancing, supposedly. You cannot, your physical strength is not that much that you can get up and do a dance. But anyone can watch, some funny series on the TV, or, something which is light-hearted, something which will just, make you forget. So I always used to tell my fellow patients, you watch this series, this is very funny. So it will make you laugh. It will make you smile. And as we all know, laughter is the best medicine. So that will, I think, it can be very simple, but you should have something, some hope, some hobby to take you out of this.
So Dr. Prachi, here, let me also share something. You know, I had Hodgkin's, and during my treatment for chemotherapy, it was like I used to do a lot of embroidery and painting, fabric painting. And I still have the saris which I have embroidered and done fabric painting. It's almost like 30 years now. But they are the most prized possessions that I have. You know, I feel it's like a heirloom that I've got with me, because each time I see them, it reminds me of those times, you know, and pleasant memories. So
Yes,
I can
exactly.
understand.
That's what the exact thing you said, ma'am, that, you know, when you are going through it, you cling on to the negative memories so much. And after 20 years, you know, you will not remember the negative things. What you are remembering are all the good things that you did, all the positive things that you did. You know, it's something to learn, that you are associating your diagnosis with a positive thing. And that is something which is to be needed to, you know, make people understand who are going through this, that it doesn't have to be all negative. It can be positive.
Sister Pinto, any message that you would like to give to the patients, to your fellow nurses, to everybody?
To patients, they have to be always positive, as I said earlier, and just fight it out. Go ahead and fight it out. Whatever comes in your way, just fight it out. And for my nurses, I think I always tell them, you be in patient shoes and see where they are. That makes you, if you think that this is my own relatives and you will care for the patient, that is going to be, definitely good. And keeping them happy about, basically what they want is that leave. So whenever they request me for a leave, I always give them. And then sometimes we can have our treats or pot parties, just to relieve their pressure, because they are, under a lot of pressure. So what we do is that having some common prayers or something. Anapana is a meditation of 10 minutes that can be done. Or sometimes we go for a picnic. So this is what I'm telling them. This will definitely relieve the pressure and you'll be able to work. So that your 100% output is there. So, and I am in front of them.
Thank you. Thank you very much. And thank you both to you, sister, and to Dr. Prachi for being with us and for, helping us honor both of you and, understand how as a patient and how as nursing staff things can happen.
Yes.
And we are very, very grateful that you could take out some time to talk to us. Thank you on behalf of all of us.
I also want to thank Sister Pinto, first of all, for including me in this, and also VCare for giving me this opportunity. It means a lot to me. I cannot tell you all how much this means. Even if one person gets some amount of positivity from me, I consider it as a win. So it really, really thank you. Thank you so much.
Thank you.
Sister Pinto, long distance hug to you.
मिल गया I want to say to Vandana ji, because till date I don't know who gave you my name to be here today, but whoever has given, I think that I've made a justice to it. So I think it's nobody but Dr. Naveen Khatri would have given my name. I am sure about it.
No, sister, you have to keep guessing.
So today I was telling him that I'm little nervous. He said, no, you just have to go and share your experience. I think you can do it. You just don't have to be nervous. But yes, but this is, thank you so much for giving me this platform. And Vandana ji, I'm always there if there is anything. Initially, I said no because of my, the daughters, all those things were there. So that is why. So once again, thank you so much for those who are watching. It's again, as Prachi said, I hope my nurses can take something, at least 5% from me. I'm happy. Thank you so much, Vandana ji.
Thank you.
Yeah.
Thank you very much.
Yeah.
Thank you, everyone. Thank you.
Bye.
Bye.
Bye. Bye. Bye.
Take care. Yeah.